Hello everyone. A very good morning to all of you. Today I am going to talk about screening and diagnostic criteria of type 2 diabetes mellitus. If type 2 diabetes mellitus is diagnosed earlier, appropriate management can be done. It also provides an opportunity to screen the cardiovascular risk factors and institution of measures for their control. Screening for type 2 diabetes mellitus should be carried out in all individuals more than 30 years of age, and it should be carried out at an earlier age in adults having family history of diabetes mellitus, persons who are overweight or obese, and people having hypertension or taking treatment for hypertension. History of dyslipidemia, history of gestational diabetes mellitus or macrosomia, and sedentary lifestyle. People with history of CVD and polycystic ovarian syndrome should also get a screen for type 2 diabetes mellitus. Now, we will know about how to screen the type 2 diabetes mellitus. Screening of type 2 diabetes mellitus is done by fasting blood sugar testing, OGTT or oral glucose tolerance test or random blood sugar test, and glycated hemoglobin or HbA1c. However, in India, there are some limitations regarding this use. Screening for type 2 diabetes mellitus preferably should be done at healthcare setting, but alternatively, community screening can also be done. OGTT or oral glucose tolerance test, if comes normal, then retesting should be done at every 3 years. And if the person comes as pre-diabetics, then retesting should be done every year. Other aspects of a screening of type 2 diabetes mellitus are a CVD risk factors should be identified and should be treated. Diagnostic criteria for diabetes mellitus are symptoms of diabetes mellitus plus random blood sugar or RBS should be more than or equal to 200 mg per deciliter, and fasting blood sugar should be more than or equal to 126 mg per deciliter. Along with these, postprandial OGTT should be more than or equal to 200 mg per deciliter, and glycated hemoglobin should be more than or equal to 6.5%. If any test is positive, then it should be further confirmed by another test subsequently. Now we will know about symptoms of diabetes mellitus in short. Along with polydipsia, polyphagia and polyuria, tiredness and weakness is also felt, and sometimes you can feel pruritus also. People with diabetes mellitus can also experience recurrent UTI and delayed healing of wounds, but more than half of the people may not have any symptoms. Now, when to say a person he is a pre-diabetic? Pre-diabetes is a condition when the blood sugar level is higher than the normal but not so high to say it is a diabetes. Pre-diabetics can have impaired fasting blood glucose and impaired glucose tolerance test. Diagnostic criteria for diabetes and pre-diabetics are summarized in this chapter. Now, we will know about OGTT or oral glucose tolerance test in a brief. OGTT should be done after overnight fasting or 8 to 10 hours of fasting. In OGTT, two blood samples are taken. First one is in the fasting and second 2 hours after taking 75 gram of glucose. Glucose load should be drunk within a period of 5 minutes after taking the fasting blood glucose sample. Second sample should be collected after 2 hours, and in between the samples the person should be resting and should not smoke. Children and adolescents should also get screened if they are overweight, family history of type 2 diabetes mellitus, signs of insulin resistance, dyslipidemia, hypertension, and PCOS. This is the end of today's topic. If you have any query regarding this, you can write in the comment box. Thank you.